This is the second part of hashtag Lexington Dr. Kevin Kavanagh. Dr. Kavanagh is a retired physician, and he is also the founder and president of a national organization called Health Watch USA. How are you, Dr. Kavanagh?
I'm doing well, Jack. Thank you very much.
Good. Staying healthy and staying inside for the most part?
Staying safe, yes, for the most part, yes.
But now, last Friday, you went to the doctor and had a skin lesion removed, and that's personal, I know, but you told me it was okay because you wanted to talk about that.
Well, yes, because I think a lot of what we do is trying to reflect on the news, and of course we hear bad news after bad news after bad news. This week there's some more bad news as it's framed by the media, but I actually think there's some good news in there too, and we can talk about that later. But one of the things that I get scared of is that people will not go into the doctor when they have to go. And that's important to talk about. First of all, Kentucky has low rates of infections right now. So your chances of getting this virus at a doctor's office that's not treating COVID patients now is not that great. And your chances of getting sick from your illness or your disorder that you have that you're not getting treated is probably much greater. And doctor offices are set up to take care of this. So for example, I had over the past 4 weeks a little lesion or a little bump on the side of my neck. It was very small, but it was starting to grow and scab over, and there was some thickness to it, and I couldn't really see it, so I was worried about it. So the question is, do I go in and risk being exposed to COVID and go out of my self-isolation, or do I sit at home for another 6 to 8 weeks? Well, first of all, the risks of going to a doctor's office, such as a dermatologist, is probably pretty low. If you're worried about having something on your neck or a cancer, or you're worried about chest pain and heart disease, you need to first think about that illness and the risks of that and seek medical care. So the first step that I did is I called up the doctor, because that's what you want to do. Many types of ailments can be taken care of over the phone or with telemedicine. But this kind of needed him to see it. I mean, I couldn't even see it. It was behind my jaw. So I came into the doctor's office. And when I did that, they first asked me, well, what symptoms are you having? And they asked me if I had a fever or any other symptoms of COVID, which I didn't. I was instructed to wear a mask, which, as you know, I think is very important at any retail establishment. And this is what doctors are doing for their otherwise healthy patients. My food handlers, grocery stores should be doing the same thing. So we drove up at the appointment wearing a mask. They had a check-in counter outside the building. Nice girl was sitting there, a nurse who was also wearing a mask, and I was told that, well, go park your car and we will call you over your cell phone. Now, I didn't have to fill out any paperwork. So it was kind of like back when I was in high school and I went to a doctor's office. Kind of wondered why we didn't fill out any paperwork. And believe me, if we reflect on the good things that came out of this clinic, it's going to a doctor's office and not having to fill out and read 10 pages of paperwork before you're being seen. That goes in the positive category. So we got to the parking lot, sat there and wait. They called us back. The nurse was wearing a mask, opened up the door, waved us in. We went through an empty waiting area, empty reception area, went right back to the room. I brought a little wipe with me, so I wiped down the seat and chair. The dermatologist came in, took a look at the lesion. Now, he was wearing a mask, took it off with a biopsy. It was cut off, it was curetted and cauterized. And I then, after that, left through the back door, didn't see anybody, got in my car and went home. I don't think I saw more than 3 people, and they were all wearing masks. So it was a very safe thing to do. The biopsy result came back. It was a very early skin cancer. So if I would have sat there and waited now 2 months, I would have probably been into a much bigger type of a procedure, maybe even Mohs surgery. instead of just getting the thing off, being done with it, and having no further problems. And this is what we really need to start to do. We really need to start to learn to live with this virus, doing things smartly, but at the same time, not being cavalier and putting ourselves in danger.
Excellent. Well, you never want to say congratulations on having early stage cancer, but in this situation, congratulations because you were smart enough to go ahead and get it taken care of.
Well, thank you. And I think everybody needs to do that. If you have a doctor's appointment, call in. They're not seeing patients that have COVID-19 symptoms in the doctor's office. And granted, you do have asymptomatic carriers, which you have to worry about, but they're wearing masks. You're not getting next to other patients, and it's much safer to do that than it is to go without medical care. I mean, children need their vaccinations. People need to still follow up on significant heart disease or high blood pressure or any of these items that they have. And it may be that if you have high blood pressure, you can do a telemedicine visit. If you don't have a blood pressure cuff, they could help you get one, instruct you how to use it, and then monitor your disease better at home. And that, of course, would be safer. But you can't neglect your health just because of this epidemic.
I thought of a question that during the week this week, and I'm glad I remember because a lot of times I'll forget, that I wanted to ask you. You can either, it seems like you're either for the virus asymptomatic with nothing or full blown symptoms. And my mom used to refer to it as getting a touch of something. Is there anything in between? Can you get a touch of COVID?
Well, I think you can get a touch of COVID, but there's definitely something about this virus that affects certain people worse than others. And of course, when you get above the age of 60, you get into a high risk category. It really does hone in on the elderly, but also the young can become very sick. And one of the things you've seen a lot on the news is this PIMS syndrome and all these other multisystems that tend to be infected by the virus if you become very, very sick. If you go into the ICU, there's, of course, a chance you can get lung damage. There's heart damage people talk about that can occur. And no one knows yet if this will resolve, what the incidence is. Again, the virus, we're just learning about it. But don't think this is the flu virus. It is a dangerous virus, and it's something that we need to keep in mind as we open up our economy. We need to do it safely. People need to wear masks. And that kind of brings us into the positive things which I think have come about. And I don't know if...
Good, I want to hear positive.
Well, there are two positive things. One is there's some new studies out which shows that wearing masks actually can significantly decrease spread. That's from spreading asymptomatic carriers that's wearing a mask to other people. And that's good because that gives us another tool in preventing spread of the virus and getting a handle on this epidemic. So I really view that as a positive. And of course, I think that all retail establishments, restaurants, stores should be requiring everybody to wear masks. That's hard to do in restaurants because you've got to eat. But if you do open, you're going to have to open safely. And restaurants will be, I think, hard to do. That's probably one of the hardest to try to figure out how to prevent spread. So that is a very good positive. The other thing is that the numbers have been falling, and I think we talked about this earlier, possibly last week, that in my calculations, looking at the daily number of cases and deaths, they are going down. And so that's very good. Now, of course, you're hearing all this dire warnings of the media that we're opening up the economy and things are going to double and we'll have 147,000 deaths by August 4th, etc. Those are based on projections. There are so many factors in those models that I'm not sure how reliable those are. And when all of a sudden you double your projected number of deaths per day, to me, you've got to be a little suspect of that and say, well, maybe it could go a different way. So right now things are falling. If people open up the economy responsibly, if they wear masks, if they do social distancing, and if we have some seasonality with this virus, with this warm weather, none of that may come to pass. We may actually have a lull during the summer.
Go ahead, hang on just a second. We're going to take a break. Back, Jack, Pattie, Holly Brady, and Dr. Kevin Kavanagh, and you were in mid-thought, Dr. Kavanagh, but hold that thought. We've got a call here. Let's take that. Mary, good morning. You're on with the doctor.
Good morning, gentlemen. I have a question about testing. 3 people in my family were sick in December and January, and we all went to our 3 separate doctors, and nobody was tested because nobody was talking about it then. So we went this week again, and we talked about antibody testing. And all 3 separate doctors, all 3 here in town, told us that if you had the illness and your body mounted a pretty decent immunological response, you would not have antibodies. So having the test would mean nothing. If you have the antibodies, you're going to go into some national computer program that says, yeah, these people had it. And one other thing, if they test me today and I don't have COVID, I could get it tomorrow. So my question is, I guess I just want you to kind of expound on that. What would be the point of being tested? Are we going to test everybody every day forever?
Well, I think there's 2 types of tests. There's an antibody test, and then there's a test that looks at the viral particle, whether it's the antigens on the viral particle which you're trying to develop or the RNA in the viral particle. If you had this infection many months ago, the chances that you're shedding the virus or have the virus is pretty slim. And thus, that's probably not the test that you want to have. If you have antibodies, that means you had an infection of COVID-19. Now, the antibodies will form after you have an infection. That's how a person gets rid of the infection, and you will carry the antibodies with you. So if there is a reliable antibody test, and I say if because right now that's the big problem, they're not that reliable to the point where many have been pulled or not being used, and you had antibodies, then you are probably at a lower risk of getting a COVID-19 type of infection. It shows that you've mounted an immune response. At the very least, it shows that you've mounted a response and survived the first exposure to the virus, which means if you're exposed again, and even if you get sick, you'll probably survive that and maybe have even a lesser type of an illness. Now, whether or not those antibodies actually confer immunity is a question that's been debated in the news media, but usually they do. Not always, but usually. For coronaviruses, that may last for 1 to 2 years if you're talking about the nasal virus. MERS and SARS, maybe a little bit longer. A lot of it depends upon how sick you got and how big of an antibody response that you get. I like to use the 1 to 2 year range because that's kind of in the middle of possibly being immune. But then you also have the problem, this is an RA virus, it mutates. Could you still get sick from the other strain? Maybe not as bad, but still get sick. That's not known. There's just so much about this virus we don't know. And people are getting really frustrated at these antibody tests, and they're getting frustrated at not having accurate tests. But remember, normal development of the test usually takes 1 year or greater, sometimes 4 or 5 years, to make sure it doesn't cross-react with other types of coronaviruses, to validate it, etc. These things are being cranked out in weeks. So they're not going to be that valid. You have to take it in the whole context of what your job is, what you want it for, what your symptoms were. And so that you kind of have to talk with your doctor. So I kind of agree on not getting an antibody test right now. That's something I'd like to get myself, but I don't think there's an accurate one out there that we can get a hold of. That's correct, because they have a very high false negative rate, the tests. And that's one of the problems with the test. And that's why a lot of them are not being offered here in Kentucky. I researched that, and there were 2 of them. I think it was a Premier and the Sure test, but they're only available in England. Those looked halfway good, but you couldn't get them over here.
Thank you, Doctor. We'll talk to you on Monday. And stay with us. So, update from the Information Center is coming up next.